All right, what's up, guys? Dr. Webb here. I'm an orthopedic spine surgeon here in San Antonio, Texas. Just came across this frightening news about Bills safety Damar Hamlin during the game between the Buffalo Bills and Cincinnati Bengals, and heard that they were doing CPR on field. Like, that's crazy. And also using a AED, which is a defibrillator. So it looks like he got hit by the Bengals receiver T. Higgins as Higgins was running upfield after a catch, and he tried to get up and stand up and then suddenly collapse. What exactly happened? We don't know just yet, but we do know that CPR was in progress for almost 9 minutes, which is, that's pretty crazy. So one of the things that I suspect that likely happened is he took a really blunt force to the chest to cause his heart to essentially not work. And that's called commotio cordis. One of the things that, I'm definitely not an expert in this, not a cardiologist, not a cardiothoracic surgeon, but just from medical school and, being around a lot of athletes, I've heard of this before. Patients sometimes have underlying heart issues. One of them is hypertrophic cardiomyopathy, which is a dysfunction of your heart where the muscles are extremely large, your ventricles, and your heart doesn't work properly. In layman's terms. That's not to say that this gentleman, had that condition, but it is to say that he took a blunt force to the heart. Your heart goes in what's called ventricular fibrillation, where it just quivers. It doesn't squeeze to eject the blood, it just quivers. The blood is not able to get to the rest of your body, therefore you can die. It's one of the shockable rhythms. Ventricular tachycardia and also ventricular fibrillation. Those are two shockable rhythms where you have to defibrillate a patient. You have to use a defibrillator and to restart the heart. So commotio cordis, it's a phenomenon in which you have a sudden blunt impact to the chest that can cause sudden death, even in the absence of cardiac damage. So this is that's been around for a long time. We've known about it. It's very common in hockey players, soccer players, karate, any activity that can, elicit a relatively hard and compact projectile or body contact to the chest, and essentially causes the heart to go into a really weird rhythm where it doesn't work. So, this is pretty bad. We hear about all the concussions, things that have been going on with, a lot of the players. Tua, who had his third concussion recently, but this is one of the injuries that we just don't really hear about a lot, but it can certainly happen. I've never seen it, covering a lot of sporting events as a resident, but one of those things that, is in the back of your head that this could possibly happen. Looking at a little bit of data in the US, this is from Medscape, approximately 15 to 25 commotio cordis deaths are added to the US commotio cordis registry every year. Wow, they have a registry for this. 95% of these occur in males. 80% of these episodes occur in whites. The prognosis, based on the most recent US commotio cordis registry data, 58% of individuals have survived this in recent years. So the most important thing is actually to start compressions and also to essentially defibrillate the heart. So the chest compressions, they result in electrical capture of the ventricles, which they, that's needed to get the heart back up and working. So it is one of those conditions that does have a mortality of about 10%. This is from their registry. from 1970 to 1993. But serious injury, and that's kind of my interpretation of kind of what's going on. He took a really blunt, hard hit to the chest. His heart essentially, absorbed all of that force. It went into a condition called ventricular fibrillation, where it just quivers. And you can see that on the EKG, these little squiggly lines. That is a shockable rhythm. You need to do CPR. Medications need to be administered. How quickly you do CPR, and elicit defibrillation matters. Luckily, someone had that in their head to, hey, we got to get this, we got to initiate CPR. That's important. Damar Hamlin took a big hit into his chest. They just did several minutes of CPR on the field, as well as what it sounds like defibrillation. Hopefully we get some more information and I'll be able to update you guys soon. We'll keep them in our prayers. This is Dr. Webb. Thank you for watching. We'll see you next time.